It's about 6 inches long.
And it's got like a blue belly when you flip it over.
Evelyn Jones of Castroville has been married for more than 20 years. She and her husband, Jeff, have raised 2 children. Evelyn's always been healthy and taken good care of herself with a routine that's included regular mammograms. Doctors had been monitoring one suspicious spot on her breast for several months, and when another one appeared, they suggested further testing.
He said, let's just be on the safe side. Let's go ahead and do a biopsy on the one we've been watching and the other one.
An ultrasound-guided needle biopsy, along with more sophisticated imaging, revealed a stunning diagnosis.
Here's the tip of the mass.
Evelyn had cancer, and it was an aggressive form.
And he said, okay, Evelyn, it's breast cancer. And I was thinking, what? That's when I was diagnosed, and that's when the journey began.
Evelyn had many choices to make, including whether to have a lumpectomy or mastectomy. A nurse navigator at the Baptist Breast Center helped her wade through all of the options.
It's just really important to help them figure out what they want.
Maybe it just takes some getting used to.
Many women don't even realize they can opt for breast reconstruction at the same time as their cancer surgery. The nurse navigator provides important education so patients can choose.
There have been a lot of studies that indicate there's increased depression, increased anxiety when we don't do reconstruction on patients. A lot of patients don't even realize that they're a good candidate for reconstructive surgeries.
When Evelyn decided on a double mastectomy, she didn't think reconstruction was for her. But in talking with surgeons and her family, she changed her mind.
I'm young enough. I'd like to be here several more decades. And I thought, it's not such a bad option.
I feel Evelyn's still a young lady, and it was something that I wanted her to still feel like a woman and be happy with herself.
Plastic surgeon Dr. Gary Arishita builds normal-looking breasts from the patient's own skin and fat. It's a 2-part operation, with the first reconstruction taking place at the same time the cancer is removed. Part 2 happens several months later.
It helps women move on. Being able to feel whole again is something I hear a lot.
Dr. Arishita helps many breast cancer patients at North Central Baptist Hospital. He says he wishes more women knew about the option of reconstruction from day one.
They at least deserve to know what their options are so that they can make their own choice.
I don't think women know they have that option, that they can go forward and get back to their life as soon as possible. It's a long journey, but it's a journey that through love and support, they can make it.
Okay, what's best?
Evelyn has started taking part in a support group sponsored by the Baptist Breast Center. She and Jeff share what they've learned during the first part of Evelyn's journey, a journey that started with a startling diagnosis, progressed to surgery and chemotherapy, and is ending with her transition from patient to survivor.
She is a survivor.
And reconstruction is helping her move on.
I feel like my old self.
Comprehensive breast cancer care that helps women from diagnosis through reconstruction. That's the difference. That's Baptist Care. For more information, log on to baptistbreastcenter.com or call 210-229-2289. For the Baptist Health News Network, I'm Wendy Rigby.